Monday Morning House Calls, sponsored by Appalachian Regional Healthcare.
Welcome back inside Mountain News this morning. Today we're being joined by Lesa and Carla, and you guys are registered nurses with the Hazard ARH Chest Pain Accreditation Clinic, and that's what we're talking about today. So first of all, Carla, can you explain to me what chest pain accreditation is?
Chest pain accreditation basically means that we have met or exceeded the standards of care for cardiac patients. The goal is that you are out in the community telling people, that they need to seek treatment. We want them to seek treatment in that critical time from the time that they have chest pain. We want to make sure that they know to get to the hospital and get treatment right away and get that taken care of.
Now you bring up time, which is a very important term when we're talking about chest pain. And a lot of things people say is time is muscle.
It is.
Explain that a little bit.
The longer that you have chest pain and that it goes untreated, then the more damage that can be done to your heart itself. So the quicker you get to treatment and the quicker that your problem gets resolved, you're actually saving damage to your heart.
Definitely. Now, some people that might have to have some of these procedures or something, what might someone look at if they are seeing chest pain? Because sometimes they're just scared.
Right, and sometimes they are. Basically, what's going to happen is if you come to the hospital, you're going to get what's called an EKG, which is just they put electrodes on your body, and basically they do an electrical recording of your heart. And based upon that, it could be anything from you may end up having to have a cardiac stent, which is just like a little piece of metal that they put in the artery itself that kind of opens it up. Or, it can go on to open heart surgery if that's possible.
Okay, Carla, or Lesa rather, what are some of the symptoms that someone might see?
Some of the symptoms that you may see is you may have shortness of breath. You may have chest pain, of course. You may have numbness, tingling in your left arm. You can have jaw pain, neck pain, shoulder pain. That's some of the more common signs and symptoms that people know. Women, on the other hand, they're kind of atypical with their signs and symptoms, and they can have shoulder pain, neck pain. They could have nausea, vomiting, GI symptoms. So it's very important that women acknowledge that these types of GI symptoms could be a cardiac-related issue and that they seek treatment.
And really quickly, if someone does need help, who should they call?
They should call 911 immediately. The most important thing, as Carla mentioned, was time is muscle. So the minute that you have any of these symptoms, you don't have to have them all, but if you have any of these symptoms, you need to call 911 immediately. Go to the nearest ER if you can, but the important thing is to seek treatment immediately to save muscle for your heart.
All right, well, Lesa and Carla, very helpful information. Thank you so much for joining us today. And Chef Walter is next.